All right, so we're going to talk about the recovery from a tummy tuck. So first off, let me start by saying tummy tucks are awesome. I love tummy tucks, probably my favorite procedure to do. You know why I like them so much? So in plastic surgery, there are procedures that are awesome procedures. A facelift is an awesome procedure. You can do it, you get amazing results, they last forever. It's a good procedure. A tummy tuck is like that. You can get a perfect result or a near perfect result with a tummy tuck, and it will last a lifetime. It is a good surgery. So a lot of people ask me though, when you do a tummy tuck, what's the recovery like? Well, the recovery from a tummy tuck can be a little tough depending on depending on the person, depending on the patient, depending on how you look beforehand, and what all needs to be done. So whenever I see somebody for a consult for a tummy tuck, there's always three things I'm looking at in the abdomen. Do you have extra skin? Do you have extra fat? And do you have rectus diastasis? Those are the three things that a tummy tuck could correct. And we correct each of them a little bit differently. So extra skin, you basically have to have that to get a tummy tuck. And then we pull it really tightly and we take off the extra skin, leave you a little scar. Rectus diastasis, which is separation of the abdominal muscles, we repair that. And then if you got extra fat as well, which most of us do, you do liposuction at the same time. It's really common now to liposuction pretty much the whole trunk as well as doing a tummy tuck at the same time. And you should do that in most cases because it gives you better contour. But your recovery is going to depend on which of those things you have and how much of those things you have. So the recovery from a tummy tuck with 360 lipo is going to be a lot harder than a tummy tuck with just skin removal and diastasis repair. So if you're really skinny, you've got almost no extra fat, just a little bit of rectus diastasis, your recovery is going to be a lot easier. Generally speaking, you have to walk hunched over for a couple weeks until the skin stretches out. You can stand up, and that causes people some back pain. We also use long-acting numbing medications inside of the abdominal wall and the repair, which can help a lot with pain. We also like using a brand new medication. It's called Jurnavix. It is a non-narcotic, non-opiate, non-addictive, non-controlled medication that you take twice a day, and it helps with pain. We found it to be wonderful. And then we also give narcotics too, just in case. Sometimes we'll give a muscle relaxer if there's a little bit of muscle cramps. There's some pharmacologic things we can do. The big thing about tummy tucks and where people go wrong is if you're on narcotics and you don't take laxatives. Absolutely have to keep moving after a tummy tuck. If you get constipated after a tummy tuck, it is a disaster. And I've actually seen some pretty big complications from that. People that take a bunch of narcotics and then don't get moving through it. So there's that. Overall, I would say the recovery from a tummy tuck is not that bad. There isn't a ton of pain that you hear about. Most of what people complain about is the walking hunched over and the activity restrictions. We don't want you doing any heavy activity for 3 weeks, nothing that can get your heart rate up. The reason we do that is because at the end of surgery, all the blood vessels that we coagulated and clotted are basically just held together by a little platelet plug, like a little bit of a plug. And if you get your heart rate and blood pressure up, squirts that plug right out and you can get a hematoma or bleeding into the surgery site. So for the first 3 weeks, stay really chill. After 3 weeks, you can start doing more vigorous exercise that gets your heart rate up, but still no heavy lifting. After 6 weeks, you can start doing heavy lifting with your extremities, but still no massive core work. The rectus plication, the repair of the abdominal muscles, takes a little bit longer to heal. Then you're free to do anything you want at 3 months after surgery. Overall, I would say the recovery from this surgery is not as bad as some, but is a little worse than others. But with multimodal pain control and all the things we do to help control pain, it's not as bad as it used to be. It's an amazing procedure. It is one of the good ones in plastic surgery, and it's something that don't let the recovery get you down. Everyone's happy to do it. Like, it has a hugely high satisfaction rate among plastic surgery procedures. It's a good one.